If you've been diagnosed with atrial fibrillation, also known as Afib, you're not alone. Afib is the most common type of arrhythmia, or irregular heartbeat, and affects more than 33 million people worldwide. The good news is that Afib can be treated. When you receive an Afib diagnosis, you and your doctor will discuss what treatment option is best for you. Your treatment will be based on the frequency and severity of your Afib, as well as the symptoms you are experiencing. For some patients, medications can effectively control their symptoms and are the first course of therapy. If you don't respond to medication or experience negative side effects, your doctor may recommend catheter ablation, a safe and effective procedure performed by a specialist called an electrophysiologist. A catheter ablation treats arrhythmias by restoring the heart's electrical signals to achieve a normal heart rhythm. If you and your physician have determined catheter ablation is the best treatment option for you, here's what you can expect. Once your procedure is scheduled, your physician will provide a list of instructions. This may include stopping some prescriptive medications, ceasing to consume anything other than water the night before your procedure, and other instructions you'll need to follow. Your doctor may also schedule an imaging procedure to evaluate the anatomy and condition of your heart before the ablation procedure. The day of your procedure, you'll go through the hospital check-in process and complete any required paperwork. Once admitted, you may have an initial blood test to identify any potential risks. The anesthesiologist will meet with you to discuss the type of anesthesia you will receive based on your particular situation. Once in the procedure room, the EP lab, you'll be greeted by the nurses and lab staff. To prepare for the procedure, there will be several sensor patches placed on your chest and back. These provide information to assist with the procedure and monitor the electrical signals in your heart. In most cases, you will be given sedation just prior to the start of your procedure. Catheter ablation is a minimally invasive treatment. During the procedure, your doctor will make a small incision in your upper thigh, near your groin. A small tube called a sheath will be inserted into the blood vessel. A device called a mapping catheter is then used to create a 3D model of your heart and record its electrical activity. Your physician will analyze the signals and use the information they are seeing to determine the best treatment strategy for you. After mapping is complete, your physician will place an ablation catheter inside your heart that is used to block the irregular signals that cause Afib. The catheter uses radiofrequency, or RF energy, to block signals in small areas, less than 1/4 of an inch, responsible for your irregular heartbeats. Your physician will continue treating these irregular signals until a normal heart rhythm is restored. At the end of the procedure, additional tests will be performed to ensure effective treatment. Procedure times can vary depending on your anatomy and your physician's treatment strategy. Some patients may get an additional device implanted that will continuously record their heartbeat and remotely report results to their EP to monitor procedure success. Following the procedure, your medical team will move you to a recovery area or hospital room. Depending on your condition, you may be able to go home the same day, but often patients will stay in the hospital overnight for monitored recovery. Remember, your doctor is your best source of information about what to expect during your immediate recovery and will provide instructions to follow. Once you leave the hospital, there may be some restriction on activities for several days. Typically, you will have a follow-up appointment within the next few weeks. As you recover, taking care of your body and mental health is important. Your recovery time will depend on your unique situation. Keep all scheduled appointments after your procedure and talk with your friends and family about how they can support your recovery. By learning about Afib and discussing treatment options with your doctor, you're putting yourself on the path towards a more healthy, active lifestyle.